Right, guys. So, how we can prepare for PLAB 2? Yeah, let's see. So, just want to say about Aspire, we are, two tutors you'll find here, myself and Dr. Nikhilesh. Yeah. Okay, so study planner. Now, the thing is, how many stations I should be doing on the daily basis, right? So actually, it depends on when your exam is, right? So I can't say like, okay, start with 10 or 15, but obviously start from a bit less, and then daily what happens is when you get used to, you can increase the number of stations as well, right? If, for example, as I said, we have got roughly around 450 to 500 scenarios we have got, right? So if you have got, say, 2 months, for example, then you can go with 15 stations per day as well. But those who have got like only 1 month and all, so what you have to do is you have to go for 30, 35 stations maybe on the daily basis, right? To be honest, it's not that much. It looks like, oh, 35 stations. I'm not saying you have to practice every single station, but I would definitely advise you to practice every kind of station. For example, chest pain. Chest pain, we have got stable angina, we have got unstable angina, we have got MI, we have got musculoskeletal chest pain, we have got pericarditis, we have got so many scenarios. I'm not telling you to practice every single kind of scenario. Just practice one or two, and what happens is you'll get the understanding how I'm supposed to take history for a patient who's coming to me with chest pain. So that's what you should do. So first thing is I would like you to make a group, practice group. How many people should be there in the group? I would say 3 to 4, not many. If you have got too many people, what happens is then there will be less practice, more of talking. I don't want that. So what I want you to have is practice partner 3 to 4, and preferably if you're having 4 practice partner, 2 males, 2 females. That's really important. See why? What happened is when we practice, there are a few questions. A male is gonna be a bit hesitant asking to a female, and vice versa. So what we want, if in a group we have got 2 female, 2 male, that's much better, right? So what you need to do is you need to make a plan. Okay, so our exam is this, and we want to finish our entire course say in 15 days. Fine. So what you need to do is maybe you have to take 30 station in a day. 30 station. Which 30 station I should be taking? Which 30 station I should be taking? Should I take all medicine stations in one go? Not really. Never do that. What you have to do is maybe we have got cardiology. Cardiology, for example, we have got 7, 8 stations. So first day of the session that we are doing, what I should take, what you should take is say cardiology. And then you can say, okay, first 5 counseling scenarios. And then first 5 ethics, maybe breaking bad news or domestic violence I'm gonna do, right? And then what happened is I wanna do 2 to 3 examinations. I wanna do 2 prescription and 1 or 2 symptom. So you have to make a plan. That group, 4 people, they'll make a plan. Okay, tomorrow is cardiology, first 5 counseling, first 5 ethics, 2 to 3 examination, 2 symptom, 2 prescription. So they made a plan. What they do in the evening, in the night, you read that. Right? You have got the notes, you read that, right? That's number 1. And if you have to see the videos, that's fine as well. You can have a look at the videos as well. So what you have to do is you are fully prepared when you guys gonna meet the next day. So in the morning, whenever you have got that plan, 3-4 hours of practice that you're planning. So 3-4 hours, you guys will sit together and then you'll practice those stations. So 1 is doctor, 1 is patient, 2 are observing maybe, and give, okay, chest pain, you do 1 chest pain, you do 1 chest pain, you do 1 chest pain, and I'll do chest pain. So 4 scenario chest pain, this is how we can do. So how many stations we had? Like 35 to 40 stations we took. And even if you practice like say 20 stations, for example, 5 to 6 each, if you have practice, I think that is done. So in one day, how many stations we were able to do? 4 hours practicing, 2 to 3 hours of reading or looking at the recorded videos and all. So how long it took? In total, 6 to 7 hours one day. And how many stations we were able to do? Around 40 stations. Just repeat it. 40, 40, 40, 40. If you do it for 10 days, 12 days, what's happening? You are done with all 500 scenarios. I know, when we start the preparation for PLAB 2, it looks, oh my God, it's too much. How I'm going to do it? It's going to be too much. I don't think so I can manage it in this much of time, that much of time. To be honest, what it needs this much time only. That is what I'm telling you after the course. Once you're done with the course, this is how the preparation should be going on. During the course, what should I do? I'm coming to that as well. So after the course finishes, after our 12 days course finishes, that should be your practice plan. If you spend that 12, 13 or maximum 15 days, okay, you can have a break as well in between. That's absolutely okay. So if you go with this plan, 15 days, you are done with your reading, looking at the videos, and also you have practiced those stations as well. Now, what should I do? So for example, in this, I have made that as well. For example, daily practice. So that's how you can go. I'll go a bit more detail as well. So after 15 days, what should I do now? What should I do now? First thing that you should do is now change your practice partner, first of all, right? Because what happens is you get very much comfortable. You become very comfortable with one group of people, isn't it? So now what you do as you're practicing with them for last 2 weeks, 3 weeks, and now change those practice partners, find some new practice partners because the new practice partner, they'll be able to tell you more mistakes as well. I think that's our aim. See, if somebody is telling you, oh, you did really well, fabulous, this and that, you get 12 out of 12. See, I don't need that kind of feedback. It's not going to improve me, right? But if somebody is telling me, yes, you did well, but you could have improved on this topic, in this area, you could have mentioned it in the nice way. So that is the main thing, isn't it? So that kind of feedback is required. But when you're practicing with the same group, they may not be able to tell you your new mistakes or so because they know your way of doing the consultation and all, right? So what is better now? Keep changing your practice partner, right? Another thing that you do is now is give a mock. See, with our course, what happened is 2 mocks are included, and I think 2 mocks are enough. But if you want more, you can take more as well. So after doing this 15 days of practice and everything, give 1 mock. Because a lot of people say, oh, I'm not prepared. How can I give the mock? I don't want to give the mock now. I don't know how I'm going to perform. See, first of all, why are you afraid of making mistakes? Come on, we come from medical colleges, and I don't know, thousands of mistakes we make, isn't it, when we are students? So I mean, why are you afraid of making mistakes? Because if you make mistakes here, you will make less mistakes in the exam. That's the aim, isn't it? I'm not saying you'll not make any mistakes in the exam. I think you're a human being will make mistakes. Will make mistakes in the exam as well. But aim is practice it again and again and again. Give more practice, and do those mistakes during the practice, during the mock. So when something similar comes in the exam, you will see the mistakes will be less and less. You will not learn things when you just read. When you read and practice and make mistake, that thing will stay in your mind. That's what we need to achieve. That will stay in your mind. And when you get that same station in the exam, you're like, that's easy. And I made that mistake during the mock session. So I have to make sure I'm not going to make that mistake here. So this is how what we should be doing. And another thing, so what I was saying is mock. People think I'm going to perform really bad in the mock. It's fine. It's fine. It's a mock, isn't it? And to be honest, if you give the mock and after the mock, every single candidate, when I ask them, what they say is, actually, I did well. What I was thinking, I did much better than that. Right. But then after the mock, why I was stressing that give mock after that. So what happened is that now okay, I'm good in history. I have to work a bit more on ethics. I didn't do examination mannequins well. I was okay in sim man, but prescription, no, I was very clumsy and this and that. So at least you know where I need to spend more time. Then what you do after this 15 days? What do you do after that? Now, as I said, change the practice partner. Now make another group, 3, 4 people again. And now instead of 40 station in a day, maybe go a bit more. Go like 80 station or 100 station a day. That's fine. I'm not telling you to practice 100 station. No. So tell your practice partner, these are these 100 station, these 30 from medicine, these 4, 5 from surgery, and these 20 from counseling, 10 from ethics, these 4, 5 from examination. Tell your practice partner, give me any station from these 100 station. And this is how you should be doing. 100 station in a day, meaning 4, 5 days, you're done with second reading, second, video you have seen and we have practiced as well. So that's it. And then if you wish, you can give another mock as well to see where I'm standing. And we do have like weekly sessions as well, like a practice session that keeps on happening, examination practice session, the hands-on mannequins, the sim practice session, prescription practice session. So that keeps on happening. Keep attending all those sessions, and you will see, okay, I'm improving day by day. Because prescription, you have to write at least daily 2 prescriptions. So what happens is like you will be very quick as well, and you'll not make mistakes in the exam. right? A lot of people, what they feel is, okay, I will see the sold prescription and I think I'll be able to write it in the exam. That's a myth. It's not gonna work like that. What you need to do, you need to write at least 2 prescriptions daily so that your hand will just write like very quickly when it comes actually in the exam, right? So this is how we should be doing it, right? Aspire hard copy is the same as online book. Yes, doctor. How many times we definitely have to come to Blackpool before the exam other than the mocks? I live 1.5 hours away from Blackpool. See, I mean, doctor, I recommend at least to stay 6 to 8 weeks after the course. But yes, I know a lot of you are working as well. You have got family commitments and all. So it's up to you. So I would say maybe 3 days, alternate days you can come. Right, that is much better because when you are at home, you will not get that environment. But when you are in the academy, you will see like 50 other 100 other candidates are practicing. Then you get that you get into that mood of practicing and all, and then you'll be able to do much better. So that's my suggestion. What's the difference in online versus full course? So online is, see, we have got 3 things. We have got recorded, then we have got the online live telecast of our 12 days course as well. And that 12 days can be attended in person as well. So online live and in-person live, same thing, but online, obviously you're sitting at your home. In person, you are in person. That's the difference, right? So obviously those who are in person, they can, they'll feel more interactive, obviously, but those who are online, then obviously we interact with them as well. But it is entirely up to you. And it starts from 10, finishes at roughly 5 o'clock. And all these are UK timings, I'm saying. Yeah. Could station be mixed in the real exam or just focused on examination history taking counseling? Okay, good question. And as I said, doctor, please attend our introduction tomorrow. I'm going to go in detailing of these questions actually. So what happened is in the exam, we have got 16 scenarios. And what happened is you'll get scenario from every single domain. So you'll have 4 or 5 history station, 3 4 counseling station, 3 4 ethics station, 2 to 3 examination, 1 sim and 1 prescription. That's what usually comes in the exam, right? So mix of everything, right? Okay. Yeah. Now, a lot of people say, okay, I'm left with only 1 week now. So what should I do? How should I prepare in 1 week now? So what is the last thing that I should say? So what you can do is you can check the recalls as well. You know, that actually gives you a lot of mental satisfaction as well. So you can check the recalls. And we have, as I said, if you come in our WhatsApp group, just scan it and come. And I'm going to put you in Telegram group. We update the Telegram group every now and then with all the latest scenario that have come in squares or street, whichever building. So you can have a look there and then practice those stations just maybe a week before your exam. That can be done as well. So if you come in the WhatsApp group, we will be able to share the Telegram group link. And if you come in the Telegram group, you'll be able to access previous 2 to 3 years of recalls as well. We have got everything lined up in that Telegram group, right? Now, so the station, number of station, doctor, I've got 16 plus 2 rest station. Exactly. Yeah. Now, one more thing. So when I'm attending the course, what should I do? Should I practice or should I not practice or just read? What should I do? So this exam is only and only about practicing. Obviously, then you will say, okay, if I'm not read, how I'm going to practice? That's correct as well. That's correct as well. So what should I do in that case? See, what I want is, for example, we have practiced one. So we have attended the class and first day, for example, we did cardiology and respiratory medicine. So we did these 2 topics, right? Then class, as I said, we finished at 5 o'clock, yeah? But it's not finished for you guys. What I want you to do is 5 to 7, you practice amongst each other. Whatever scenarios we have discussed, we have practiced in the class, I would like you to practice in your group for at least 2 hours or so, right? And then, we will be sharing what is going to happen tomorrow. So 5 to 7, you have practiced among your group. Then obviously have your dinner and whatever it is. And then in the night for an hour, read the material or read the material for the next day. What we are going to teach the next day. You can read that material quickly. So when you are in the class next day, you feel like, yeah, I'm able to concentrate even in a much better way because I already know a lot of things from this topic. So you can retain more information. And then obviously we'll finish at 5 to 7, you practice those topics again. and then for an hour in the night, just see the material for the next day as well. Keep doing that for 12 days. Keep doing that for 12 days. So what happens is, once you're done with 12 days, I know that you are not done with everything, but you will feel a bit confident. You're like, yeah, I mean, I have not done all 500, but I have done at least 100, stations and all. So that will give you confidence. And then what you do, you apply the same formula afterwards. Make a group of 4 and daily 30, 40 scenarios, and then repeat that. So that is what you are supposed to do for the preparation. That's what is important, right? So with the course itself and our course, another thing about our course, what we do in our course, do we teach? We don't teach much actually. What we do in our courses, in 12 days courses, we practice, practice, and practice. Can you guess how many stations we practice in these 12-day session? We practice around 130 to 150 scenario in the class itself. Now you tell me, out of 500, if you attend the class, you have already seen around 150 scenarios being practiced in front of you. And maybe you will also get the chance, obviously, if you are there in person, you'll get the chance to practice 3, 4 scenarios, depending on how big the batch is. So that is what is required actually. So you will learn from your mistakes, and you will see others performing in front of you, so you can learn a lot of good things from them and maybe avoid what mistakes they have done as well. So that is what it is. I mean, what I feel is PLAB 2 is not about just teaching, teaching, teaching. We are going to give you recorded courses. I mean, whenever you want to see, you can see, isn't it? But what we want to do in these live sessions, it's more of practice, 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 practice. So that's what we do. Yeah. If we miss some online class, like busy with 2 p.m. to 3 p.m., can we get the record that we missed? So, doctor, what happened is, I'll tell you about our courses. What happened is, we do share the recorded classes. Not that what is happening there, but recorded sessions are separately given to you. So it's included in the package as well, right? So let me just go through this. So what I've done is, for example, this, I was saying, you make a plan. So this is how you do it. So chest pain, for example, and then pericarditis, cough, the UTI, PPH. So that is medicine. That's medicine. That's medicine. That's surgery. That's counseling. That's counseling. And that's counseling as well. That's counseling. This is ethics. This is ethics as well. This is ethics as well. This is ethics breaking. All these are breaking bad news scenario. On child, so this is what we have in pediatrics. Preeclampsia, that's gynae, and that's psych. So we have taken these 15 stations roughly. And then what we have got is one SIMMAN procedure examination. So 2 examination mannequin, 1 or 2 prescription. So that's one day. This is around 15 stations in a day. But if you have got less time, what I said, you do this and do the next part as well. I mean, you can do 2 lists in one day. That's how you should be preparing, right? And we have made some notes as well, like what exactly, for example, in the chest pain scenario, what are the main things that you should be looking for, what you should be looking for pericarditis, what you should be looking for dry cough. So a simplified like 2 line notes as well. So if you go through that, you will see all 400-500 scenarios we have tried covering in this practice planner. If anybody is preparing for a FAB attempt, should I practice 3 stations a day, and when should I take the academy, and should I buy the pluggable gems? I really need pluggable gems. Yeah, pluggable gems you can buy. I mean, that's fine. It's entirely up to you, obviously. So you can take that as well. But pluggable, they have got just the gems, right? But what we have got is the full course. So you can have a look at the pluggable gems initially, and then later on you can apply for the course. And but if you take our course, what happens is we will be giving you the material straight away, and we have got the flashcards as well. So I know those are booked. You may not have the access of flashcard as of now, but you will get the access of flashcards as well. You have made all 400-500 flashcards. Like in half page, you'll have detailed information written, what you are expected to do in data gathering, in management, in IPS in this particular scenario. So we have made those flashcards as well. So I think you'll not have any trouble at all. Is 1 month sufficient after 12 days session with good reading at our home country? That's fine, doctor. But again, one mistake that you have mentioned here, at my home country, good reading. Reading is not going to help at all. If you're just reading, you're just wasting your time. What you should do, practice, read, practice, read, practice, 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 read, practice, practice, practice. That's what should be, right? Because if you read, like, there are around more than 1,000 pages. If you read 1,000 pages, do you think you can retain that much of information? It's difficult. But if you read 5, 10 scenarios or 15 scenario, and then you practice 5 of them, then read 15, 20 scenarios and then practice, that will stay here for longer, right? And when you read, you don't have to read doctor-patient the conversation, because you're a doctor, you take history, you know how to take history, isn't it? But then the main thing that you should read is the management. Read the management a bit more in detail. And when you practice, what you'll have idea of the time as well. The problem in this exam is not your knowledge, the problem is time as well. You'll only have 8 minutes. So how are you going to manage that 8 minutes? How much history, how much time in the management I'm going to spend? So that is the art that you need to learn and apply when you do a consultation. That's the main thing, right? All these things we're going to discuss. And as I said, join us tomorrow as well for an introduction. I'll go through these things in very much detailing as well. Right, so 1 month is enough. That's okay, but I mean, I think you understood what you need to do in that 1 month. Yeah. When should I book an academy for November attempt? See, doctors, I know like many of you have got the date in October, November, December, January. That's fine. When should I book the academy? See, if you book it today or you book it after 2 months, what's gonna be different? To be honest, I would say just book it today itself. Book it now and start preparing, right? There is no validity for this course. It is valid till your exam, till your result, till you pass this PLAB 2, isn't it? So if you join it today, what's gonna happen? You'll start preparing it from today itself. You don't have to go very fast because you have got 5, 6 months. So you don't have to go very fast. You can go very slowly. Or what you can do is maybe attend the course once online live when you are in your country. So what happens is when you attend it, you'll get a bit of idea how I should be preparing. This exam is about how you should prepare. You should understand that first, right? So do that. That is most important. So I would say from today itself, you can start preparing. Come in our group, you'll see the conversations are happening, take part in that. Online live, you can attend, recorded course, you can see, you'll have the material, you can read the material as well. Keep doing all those things. And then after a month or two, you're like, yeah, I know what is PLAB 2. Now your mind will start working accordingly. This PLAB 2 is not only medical exam. It's a medical exam come uh, more of communication exam, and also it's your etiquettes as well. How are your etiquettes and all in the hospital for your patients? So this is that kind of exam. So if you attend our 12 days, you will see we are practicing these stations. Like, for example, if I'm doing the class, I'll be the patient and you'll be the doctor. So we'll do the doctor-patient consultation. So you will see how things work. How many times the doctor is saying, sorry, please, thank you, kindly. How is their tone of voice? That also we comment on, isn't it? It's not only the medical thing. So that's what we are trying to say, like, book it as soon as possible. Right? Can we just do the mocks and simmans in your academy? Yes, doctor, we do have that provision as well. For that, if you can email, we'll be able to tell you a bit more in detail. Is there a course in London? No, doctor, we are in Blackpool actually, but if you're in London, for example, you can attend it live online as well. We use good camera, we have got good voice, so AV system, audio visual system, we have got a very good one. So, I mean, that is, you can do it from London online as well and come a few days before the exam to Blackpool. Yeah. If I have got 3 months to practice, how many scenarios a day must I do? I mean, if you've got 3 months, I would say you can do maybe 15 station. That should be okay. 15. If you do, I think in a month, you will be able to do all the scenarios and then start practicing the second round, third round. That is something you can do, right? So I think 15 station, doctor, if you've got 3 months, you don't have to go that fast. 3 months is a good time. Can I attend course online once and then again at the academy offline? Yes. You can I attend online once, twice, 3, 4? Yes. Can I attend them in person as well? Yes. No problem at all. How will the online material be like? Does it come with a candidate card or a patient script? So we have got two things. It is patient script actually. It's a patient-doctor consultation, right? Plus, then we're going to give you the flashcard as well, what is expected from you in data gathering and what is expected from you in management. So both the things will be given to you, doctor. If you miss some time or part in online class, like a few middle part, we'll be able to get that recording. See, I tell you, the recorded course will be given to you separately. It's given. But during that, what we are doing in 12 days, we don't record that. I'll tell you, there's a reason behind it. Because in 12 days, what's happening is we are practicing with each other as well. So I'm practicing with you, doctor, for example, Dr. Sharma, we are practicing with you. I'm okay to share my video to everybody. You may not be comfortable sharing your video with everybody, isn't it? So that's why we don't share that part. If you missed that, you missed it. But the recording, one-way recording, like how this topic should go and all, that theory part is there available recorded version of it. So you can access that, but not that day thing because it's not being recorded. That's the thing, yeah. Is there a crash course academy like 3-4 days which can be done right before the exam? We don't have something like that, doctor, but what we have something similar. We have got weekly sessions as well where we do weekly practice session. Maybe you can attend that, but there is no crash course thing at the moment, yeah. How many weeks before the exam should we take in-person course? I would recommend maybe 2 months before, if that's possible. 2 months, I would say. When should we come to the UK and an academy before exam? I mean, as 6 to 8 weeks you should have after in-person course. That's much better, right? So what I was saying is like, this is how you should be practicing. So for example, these are the scenarios, 15 scenarios I'm telling for a day. Those who have got 3 months to practice. Those who have got like, say, 2 months to practice, maybe they can go for 30 stations. Those who have got like 1 month time, maybe go for 45 stations in a day. So if you do that, 10 days, you're done with the first thing, right? So yeah, that should be your aim. Yeah. So this study planner I'm going to share with you guys, so that can be it's going to be better for you as well, right? So you can make the plans accordingly and you can make your notes in the practice, this planner itself, yeah? So once we pay for the course, we get online as well as offline course, or they're separate payment? No, it's one payment, doctor. What you're going to get, I'll tell you in a bit more detail as well. It's one-time payment only. You don't have to pay separately. So this is a study planner, and I'll tell you, we have actually added some all the new stations as well in it. So if you see the last one, the Down syndrome, essential tremor, mala, cranial cap, OCD, infective endocarditis, medication overuse, headache and all. These are kind of comparatively new stations. So we have added in this practice planner as well for you guys. As someone who's introverted, it's quite hard to approach others and form groups. And of course, the practice is really important for this exam. So if there is any way to get help with pairing up small groups, okay. So if you come in the academy, we have done something for that also, Dr. Alicia. We have got something for that as well. I'm going to come to that thing in a while. Just a sec. Do we get the study planner at the end of the session? Yes, doctor. I'm going to share this PDF in the WhatsApp group. So if you come in the WhatsApp group, it's easy for me to share. I'll share the link as well. So this is the practice planner. So did you understand what I was trying to say? It's like daily you practice 15 stations. If you have got 3 months time, you practice at least 30 stations. If you have got 2 months, you go with at least 45 to 50 stations if you have got only 1 month left. So 50 station, you read, you see the videos if you need to, and then practice. I'm not saying practice all 50, but practice at least 10, 15 scenarios from those 50. So do 50, 50, 50, 10 days, you're done with the whole syllabus. And then change the practice partners, and then maybe in 1 day, 100 stations, give a mock as well, see where I'm standing. So that's something that you can do. Some of my friends were saying they could attend the live course maximum twice. Is that so? I mean, we say 2 times, but there are many candidates who attended more than that as well. We will allow you. No problem at all. In our terms and conditions, we have written 2 times, but then it's fine. I'm telling you, I can give you in written as well. You can attend it more than twice as well, doctor. That's not a problem. Okay. Now, what our course includes, and as I said, I'm going to share some discount coupons as well today. So that's what we do. Whenever we have got the webinar, we do some discount coupons. Gonna valid for only for a couple of hours only. Just stay with me. Those who have not booked the course, that might be helpful for you. Yeah. Okay, so what our course includes, right? So when you book the course, our course price is actually £650, but then there are lots of discounts going on now. So if you are a group of 5, or if you are a PLABable subscriber, oh wait, I should write, let's write here. So price is, as I said, 650 GBP, but if you are a group of 5 or PLABable subscriber, any one of it, even if it is expired subscription that you have got, doesn't matter at all. So what is happening? So it's 649, sorry. So you can get it in 549 pounds. If you are a group of 5 or you are a PLABable subscriber. Another thing, if it's both group of 5 and PLABable, then you're gonna be getting it in 529, right? That is the main thing. Now, today I'm gonna give you a coupon only for 10 candidates where you will be able to book it in 499 as well. Only for first 10 people, and then this coupon will not work. Where is this coupon? I'm gonna give it to you in a while, right? So, how much is the price for by today's discount? So it's gonna be 499, doctor. Yeah. How can I download the study planner, including 30 days planner? Yes, doctor. I'm gonna give it to you in the WhatsApp group. So if you just scan this code, come in the WhatsApp group, and I'll be able to share. Kindly share the Telegram group. I'll share, doctor, once I'm done with the session. Just come in the WhatsApp group. I will share that as well. Yeah. Okay. So what our course includes actually. So yes, in-person classes and online live classes as well. I know we have written 2 times, but to be honest, till now, ask any of your friend if they have asked us to give the access 3rd time, 4th time, did we say yes or no to that? Right, so we always give, that's not a problem. And to be honest, if you have attended it 2 times, 3 times, that's more than enough. The exam is not about attending the course again and again. The exam is about practicing, practicing, and practicing. So please spend more time on practicing rather than attending it again and again, right? So 12 days session. So how it is done? It's a live session. And I'm saying, I would say with the utmost proud, I would say Aspire is the only academy in the UK who is doing the live sessions. Only academy, nobody else doing these sessions at all. Every academy have got the hybrid courses, recorded course only. We are the only academy that is doing this. That's the thing, right? Okay, so somebody has shared our Telegram group link as well. I'm going to share it in the WhatsApp as well, so don't worry. Dr. Ankur, some of us are working full-time. We will be having only 1 month leave before exam to attend in-person course. So ideally 12 days in-person session and remaining for practice. What do you suggest? Okay, Dr. Salman, that is the question that not only you, a lot of other people ask, and very genuine question. So what I would say, you get 1 month, that's fine. Now, what I want you to do when you are in your country, attend this session, online live classes, that 12 days live session. I know you are working, so what you can do, you may not be able to attend 12 days at a stretch. Attend our next batch and maybe you are able to attend 4 to 5 classes. It's fine. Attend our next batch as well. Maybe you are able to attend 4 or 5 classes. Attend our next batch as well. Then remaining 2-3 classes you can attend there. So you're done with all 12 days in that fashion. Now, when you come to the UK, you've got only 1 month. So I have seen a lot of people when they have got less time, they are attending in-person classes, but they don't attend all 12 days. They pick and choose. I want to attend examination class only. I want to attend procedure class only. I want to attend Siemens class only. I want to attend only prescription class. So you can attend, pick and choose and attend that class only rather than attending the whole 12 days again. That is the best thing. Moreover, we have got post-course support sessions as well. People, they find those sessions very useful as well just before their exam. So that is what you should be doing. So instead of attending all 12 days live, when you come to the UK, attend 3-4 classes only, specifically the examination, mannequin, simman, and prescription. And rest, maybe you can do it online. So when you're in your country, do this as well. Yeah. Where I can find the pre-recorded videos on the website. It's there, doctor, on the recorded session. Any doubt if you've got and you're not able to manage it, just put it in the WhatsApp group and one of our admin, either it's Mr. Vivek or Mr. CJ Chiranjeevi, he'll be able to help you out. And if there's any trouble you're having in accessing the recorded materials and all, right? Just put the message in the WhatsApp group, or you can find one of the admin in the group and just message the admin directly and they'll be able to sort it out for you. Or you can email us to info@aspiretoplub.com and we'll be sorting it out for you. So what our course includes, was coming to that. As I said, in-person classes and live online classes, that's what you can attend. So that's the main thing, right? Now, you have got the access for the pre-recorded videos as well. And you know what other, as I said, other academies and all, what they do, they are completely actually relying on the pre-recorded videos only. We do have pre-recorded videos, we're going to share it. So there are 3 things that you will be having. Number first is pre-recorded videos. So they're around 40 hours video. You can see whenever you have time because it's recorded. But these 2 things are live, guys, live. So you have to attend with the live session whenever the batch is happening. You've got 12 days batch happening, and the dates are announced till the end of this year. It's there on the website. So you can pick and choose, can attend once, two, three, four, 5 times, no problem at all, right? Then what else you have got? You will get the comprehensive material books as well. So every, like as I said, we have got 400-500 scenarios. All 500 scenarios will be getting in this as a material book as well. Detailed examination mannequins and everything will be there in that material, right? Any new station, we keep on updating ourselves as well, and you'll be able to see it in our WhatsApp groups and all, right? 2 mocks are included. This price that I mentioned here, this price, it will have 2 mocks as well. Now, a lot of people were asking, like, am I going to pay separately for online classes, for recorded classes? No, this price today, I mean, as I said, so it includes everything, whatever I'm mentioning. It includes 2 mocks as well. A lot of other people were there saying, okay, our course is 200 pound, 100 pound. And when you go there for practicing in the academy, they charge you for that. When you come for the mocks, they charge you for that as well. We don't charge for anything. It is included in it. That's what I'm trying to say. So 2 mocks, 16 station, the way it happens in the real exam, you'll have it here as well. So you get 2 mock session included with the course. Yeah. What if I get only 1 week off before my exam to come to the UK? How should I proceed with the in-person classes? Then I don't think so, doctor. You'll have time to attend in-person classes. So what you can do if you've got only 1 week, first thing is you have to attend mocks. 2 mocks you can attend in 1 week. That's fine. Plus, you should be actually attending our post-course support session. What it is, I'm coming to it. It's a bit unrelated, sir, but could you tell the management of Varu count food case in pregnant women? I mean, doctor, I'm going to have a session. I've prepared that scenario. There are 5, 6 new scenarios recently have come actually, and we have made the proper slides and all. Next week, I'll have a webinar and I'll send a link everywhere. Just attend there. I'll be discussing that in detail, right? Are there specific dates for the mocks or any date is fine? It's you who's going to decide. No. So when you're planning to come to UK, in our website, you can book your mock on your own. You don't have to ask us. You have to book it on your own. So we have got the mocks happening on Tuesday and Thursday, and sometimes it's on Saturday as well. So you can book it accordingly, right? So we have got in-person classes, live online, comprehensive material, pre-recorded mocks, mannequin practice. We don't charge separately for the mannequin practice. You can practice mannequins, that's fine. It's included in this package. Simon practice as well, support until you pass. No, post-course support session, what it is, I'm going to tell that in more detail. Academy study area, mannequin area is available for you guys. Practice with the faculty. That's what we do in our classes. We do not teach much. We actually practice, practice, and practice. For every batch, we have got an exclusive WhatsApp group for discussion as well, right? Now, this post-course support session, let me tell you a bit more in detail what this post-course support session means. So what happened is it's a big academy. So one side the class is happening. Those who have attended the class, they don't want to attend again maybe. So we have got something weekly. These sessions happen weekly. For example, last week this was our schedule. That is what we have updated. So on 7th July, for example, it was Monday. We had hands-on mannequin session. This is a part of post-course support session. It's free. It's included in this package. You don't have to pay separately for it. And other academy, they're saying this is their course only. This is free. Our course is 12 days, and with 12 days, this is free. So in hands-on mannequin session, what happens is you will have a group of like say six people. They'll be going in 4 or 5 different rooms, and one instructor is going to be there, and they'll be practicing under the supervision of that instructor. That's what happens, right? So then spam session. Now answering the question, I think Dr. Alicia asked me. I don't know if she's here. Dr. Alicia, you said like you are a bit introvert and how I'm going to find the practice partner. So here it is. So self-practice assessment of the mocks. What happened in it? We make, we have got like say, for example, a group of people, they'll be sitting in a room. And what we do is we make them sit in front of each other like this. If you see, they're sitting in front of each other. And what they're doing, they're practicing with each other. In this group, we have some of our mock examiners sitting there as well. And then what happened is after 8 minutes, what happened? These people, they're going to change their seat and then practice again for 8 minutes. Then they'll change their seat, and then again we will do that. Again we will do that. So this is how it is done, right? So this is how you'll be able to find the practice partners as well. That's how it works. right? So this is what you should be doing. I mean, I know a lot of people that are introvert, they might be struggling to find a practice partner, but this is a good idea. So this session will go for 2 hours. In 2 hours, you'll be practicing roughly 10 stations with 10 different people. And now what happened is you made 10 new friends. And then tomorrow, you will not be that much hesitant. You will not be that much introvert, and you will be able to practice with those people at least. So that's how we help you guys in finding a practice partner as well, right? I'm worried the accommodation. Heard it's not good there. Could you tell me about the Academy One unbiased? I would like to stay there for a while. See, doctor, uh, what was not good in accommodation? I think tell me a bit more in detail. I'm not saying our accommodation is 5 star, right? Our accommodation is 2 star, right? And it's a kind of a hostel. I think that life that you guys are missing is the hostel life that you're gonna get again in our academy. That's the main thing, right? I'm not saying it's the best, but it is a very good accommodation. That's the thing. It depends on the charges as well, how much we are charging. According to that, it's a very good accommodation, right? The cleaning happens regularly. You'll have all the basic facilities. All the things will be provided to you. Kitchen is available for you guys. And what else? I mean, the practice area is open for you guys. Everything is there, I mean, right? So that's, I mean, if you're asking me, I think unbiased, I would be biased, I guess. I think ask somebody else this question. But according to me, my understanding, it's a decent accommodation. And I don't think so there is any trouble and all. But obviously, those who are others, they actually try to advertise their recommendation and they try to blame, okay, say, okay, Aspire recommendation is not good and all. But why it's not good? It's a running hotel and with the 60 plus rooms. So, yeah, you will not have any trouble, doctor. Yeah, that's what I can say. How many doctors on average are there in Blackpool Academy? My concern is overcrowding. Don't worry about overcrowding. How many practice areas that we have got? We have got one practice area which can take around 50, 60 people. Then there is another one which can take at least 30 people. There is another one which can take another 30 people. There is an area in Sun Lounge that can take another 30 people. Then there is a classroom basement as well that can take another 50 people. So at a one given time, even if you have got 200 people, there is no problem at all. But it's not going to be overcrowded at all. No. We don't have more than that. I mean, hardly 50, 60, 70, or 80 people you will see at a given time. So I don't think so it's going to be overcrowded. It's not a problem. Hi, doctor, can I just say, please, shed your introvertness for 4 months if this exam is important for you at all. Also, good extroverts will adopt you eventually if one is pleasant. If this exam is important for you at all, what does it mean? Can I just say, please shed your introvertness for 4 months if this exam is important for you at all? Also, good extroverts will adopt you eventually. Female only accommodation available? Yes, doctor. So in our full accommodations side, we have said it's for only for females. Yes. What if it is overcrowded and we couldn't get the chance to practice with equipments? It's not like that, doctor. It's not like that. That's what I'm trying to say, actually. It's not overcrowded. That's why I'm saying you've got 4 practice areas only. What can happen? For example, most of the mannequins we have put in the practice area, they are in a group of 2 or 3. For example, the arm, the blood sampling mannequin, there are 2 arms we have kept. So it can happen is when you went to practice, there might be 2, 3 people already practicing on that arm. That can happen. But obviously, they'll be practicing for 20, 30 minutes and then they'll be going to the different examination. So that can happen. But as I said, those who are living in our accommodation, it is 24/7 available for them, to them. I mean, so you can practice anytime you want. So overcrowding, we have never heard that complaint actually. So don't worry about that, right? Why are female accommodation charge more? Not it's not like that, doctor. It's not. See, in a hotel, some rooms are what do you say? Sea-facing room, big room. So the price is according to that. It's not about female accommodation only. We have actually kept the good rooms for the female only side. That's the reason, right? And now we have got only one building, guys. Only one building. So that's the main thing. Only one building. So we don't have too many spaces, only few spaces. And in the Blackpool, it has got 60 rooms. So I would say book it as soon as possible. Yeah. I've heard that Aspire accommodation has poor sanitation and wet carpets on online reviews. What are your views on that? Okay. Poor sanitation. I don't understand. See, our common area has been cleaned daily. That's the thing. and the washrooms that you guys are gonna stay, because every single room is en suite, and every week those washrooms are getting cleaned as well. So poor sanitation, I'm not sure, doctor. So ask that person a bit more in detail. I think then I'll be able to help you out in that. And the wet carpets, see what happen is when it is in the Blackpool, not in Blackpool, in the UK, what happened is the roofs are like this. I'll explain a bit more in detail so you understand. Roofs are like that, isn't it? But most of the hotel roofs are actually flat roofs, flat roofs. So what happens is when it's raining, there's a bit of chance that the roof might start leaking a bit. That's one thing. Second is the washroom, the bathrooms are not like in our country. So what happens is when you're taking shower, the curtain, if it is inside the bathtub, it's good. But if it is outside, a bit of water is going to spill on the ground and that can come downstairs, I mean, through the roof. Because the roofs are made up of wood only. That's how it works in the UK. So when new people, they come in the accommodation, they are not a bit very clear how I should be using these bathrooms and all. Though we explain it, our staff can explain everything. But in first couple of days, they don't understand what exactly I'm supposed to do. And that's why what happened is a bit of water sometime might leak. But then we go into that room, we just tell that candidate, no, don't do this, do it in this way, and it's fine, right? And it's not only in our hotel, it happens in every single hotel in the UK, right? So, I mean, this is not something that we can prevent, because it's on us how we're using it. And when we come from different countries, it's a different thing when you come in the UK. So that's why it happens. Yeah. Weather in November, December in Blackpool, yeah, I mean, in the UK, Blackpool is no different, isn't it? But November, December is going to be a bit harsh, I would say. But January, February is the worst, I would say. But yeah, November, December is not very good, but still okay. But Jan, Feb going to be even more harsh. How much it costs for female accommodation? So, doctor, again, it's different, as I said. It starts from 18 to 30 pounds. You have to go on the website and check it accordingly, right? What kind of room you want. Can we share a single room with two females? Yes, sir. So we have got a single room with like twin rooms we have got, you can share. And we have got, what do you say, a double bed. And if you are comfortable sharing double bed, two female, that's fine as well. Yeah, but then we will tell you how much pricing and all. So the pricing is going to be according to that. But yes, you can share. That's not a problem. Yeah. Okay, let me explain this. So this last thing left, and then I'm going to share that coupon as well. So hands-on mannequin spam, prescription writing. So every week what happens is we got the prescription session happening as well. So for example, it started at 6 p.m. So what happens is we'll make people sit in a room. So this is like, for example, the prescription session is happening. So we give every single candidate, we give a BNF. Yeah. And then we give them a scenario, put the timer for 8 minutes, and they will do it. And then we take their sheet and we correct them and give them the feedback. And then another session. So every week this happens and we give them 2 prescriptions at least. That's the main thing. Then we have got examination mannequin teaching sessions happening as well. Every week it's happening as well. Then spam, then Simon practice. It's on real Simon, mostly done by Dr. Nikhil itself, right? So himself. So you can attend those. So those are exam next week. They'll be practicing on real Simon, real scenario, and real feedback, real-time feedback will be given to you. Right. So cement touch and treat. So what happens is we give them chance candidates, like they come and they want to feel the pulse, they want to check the heartbeats and all, so they can spend time and do all those things as well. Right. So this is what happens weekly. Our 12-day sessions are happening. This is separately. So that's what I'm trying to say. Attend it. That's what you guys have to do. So that's the post-course support sessions. Yeah. These are some FAQs, I think, if you want to. So should I select the online or in-person batch first? Doesn't matter at all. Does Aspire put accommodation? Yes, but now we have got limited accommodations only. Only one building we have got. Book it as soon as possible. When should I book for accommodation? I would say once you book the course, book it as soon as possible. Yeah. My exam is in November, December. Can I book the course now? Yes. How do I buy the books? You don't need to, you'll get the access online straight away. Course validity shows 120 days. My exam is after that. What should I do? You just have to email us and we will be able to extend it. Can we all, if we are buying a group, can we all in one group to avail the discount? No, even if you're attending different batches, no problem at all. Where I can find more details about accommodation, don't worry, we'll put that in the WhatsApp group itself. Who should I contact for accommodation related queries? WhatsApp, I'll let you know. Is there a fee for Aspire book? So it's online, it's going to be available free. Aspire book available for download? Yes. How do I extend my course validity? Just email us. Can doctors in the same group have different exam date and batches? Yes. Who do I contact for the course extension batch changes? info@aspiretoplab.com. Where should I contact for the mock related queries? mocks@aspiretoplab.com. Yeah, that's what you do. In examination, we have to be loud in repeating the findings. Yes, you have to verbalize the findings, doctor. Verbalize the findings. Yes, that we discuss in detail, so don't worry. Right, so these are our batch dates as well. So for July, as I said, so batch is going to be starting tomorrow. The next batch is from 4th of August, 25th of August, 15th of September, 6th of October, 27th October, 17th November, 8th December. And you'll find soon for the January, February as well. We can update it soon. Can bring family and accommodation? Yes, yes, yes. So, I mean, it depends how many of you're bringing, so you have to pay accordingly. And yes, you can bring your family members as well. No problem at all. Yeah. Okay, so that's the thing, doctors. So what you can do is, this is for tomorrow's classes. So if you would like to scan it, we'll be sending the details in the WhatsApp group as well. But you can scan it and come for tomorrow's class. It's going to be introduction. It's free for everybody. Those who have joined this batch, obviously they will be getting the details in the email as well. But those who have not joined our course, you can just scan it. It's for tomorrow's class only because that's going to be PLAB 2 introduction in detail. Plus, we'll be discussing cardiology and other medicine topics as well. So that's going to be a good, I would say, good kickstart for you guys for your PLAB 2. That's the main thing, right? So, yep. Okay, now let me share the coupons. So join discount coupons, guys, for the discount group offers and all. Please come in the WhatsApp group. Now live on spot offers. As I said, I'm going to give it for 10 people only, and the price is going to be only $4.99. And this is the code, guys. So if you'd like to apply, you can apply it now. And it's valid for 24 hours only, and only 10 coupons we have released. And those who are going to book it, only they can get it, and after 10 it's not going to work. So if you want, you can book it now itself. To be honest, last time when we gave this discount coupon, within 5 minutes I think people have used these 10 coupons, and then they were actually fighting for the last one. They were actually fighting. So yeah, so as I said, you can book it now. So if you put this code aspire study on spot 0725, just this coupon you have to put, and yeah, and it's gonna be there for you guys. Yeah, it's gonna make you get discount of £149, and the course price is gonna be £499 for you. Yeah. Where is the academy and how far is it from Manchester? Doctor, we are actually in Blackpool. We are based in Blackpool, which is an hour from Manchester, Hardman Street or Hardman Square, where your exam is going to be. Yeah. Can you please share the code link for tomorrow's class in the WhatsApp group? Yes, admin CJ, I think you're here. If you can share that in the WhatsApp group, yeah. He will do that. He will do that. No problem. Those who've already booked will get the gift hampers. Yes, don't worry. Don't worry. We have got a lot of other things for you as well. Those who booked it, when you come here in person, we'll let you know what else you will be getting. Don't worry. We have got, see, every candidate, those who have passed this PLAB 2 exam, they are applying for the jobs. You need one thing, which is BLS certificate. I'm certified BLS instructor. Don't worry, Dr. Sharma, I'll give you a BLS certificate. If you go outside, you have to pay at least £30 to get BLS certificate. We'll give you free of cost. Good. When I joined your course, I applied for MU5, but can I change the course date if needed? Of course, doctor, no problem at all. You just email us at info@aspiretoplab.com and we'll be able to sort it out for you. No problem at all. Yeah. Okay, so for the tomorrow's class link, yeah, we will be sharing in the WhatsApp. I mean, once I'm done with this session, I'm gonna share everything in the WhatsApp group. This slide also, I'm gonna share, no problem. Right, guys, so any questions and all? Will you renew your mock slots, or once it's sold out, it will forever be sold out? No. So what happened is, if it is sold out, we will be able to increase it as well. So if you're not able to find the mock slots, just email us at mocks@aspiretoplab.com and we'll be able to sort it out for you, right? So you don't have to worry about that. Yeah, so we can increase the number of seats. That's not a problem. Yeah. So yes, thank you so much, Aspire Rocks. Thank you, Ron. See you soon in the academy, man. Okay. Uh, I have booked the course, Doctor. Dr. Anamika. Yes, Dr. Anamika. So she's the first candidate today who has booked the course in £499. Good, doctor. And I think there's another doctor who is trying to book, Dr. Dosita Ilawarnasu. I'm sorry if I'm not able to pronounce it correctly. You're trying it, try it again, and yeah, you'll be able to book it. Yeah. Only 10 candidates, doctors, today. This discount is so you can book it as soon as possible. I want the BLS certificate too, and Dr. Alicia, I will give it to you, no problem. Everybody, don't worry. Those who are attending, you will get BLS certificate. Fine. So what happened is if you get it now, it's not of any use. What I would say, once you pass your PLAB 2 exam, you get your GMC registration, email us and we'll be able to issue you one, because it's valid only for 1 year. Right. So I don't want you to give it now and then maybe 1 year just preparing for your PLAB and giving the exam and getting the registration. So it's of no use. But yes, we'll give it to you guys. No problem at all. Yeah. Don't worry. Okay. I must say the price is exceptionally reasonable considering everything included in the course preparation. Yes, that's the thing. And Dr. Amir, one thing I would say, nobody in the UK, any academy I would say, is doing the live 12-day sessions. Nobody. If there is anybody, let me know who is doing it. Nobody is doing. We are the only one. So recorded weekly sessions, online live in person, everything is there in this package, right? So yeah, any other question, guys? So yeah, so you can put this coupon Aspire study on spot 0725. Yeah, and book it. What is the charge if only want to take the online classes? So you mean online live classes you wanna do only online live? So it's gonna be £99, doctor. But after 99, you will not have any other facility. No mocks, no practice in the academy, no weekly session, nothing is there. But yes, you can book that. If you email us, the admin will be able to help you out in that as well. Yeah. Okay. How do I book the test? You mean the mock test. So if you have booked the course, it will show you the mock dashboard. If you go in the mock dashboard and you fill the things there, you'll be able to book the slot. It's in the website itself. Any trouble, if you're having, just email us to mocks@aspiretoplab.com and we'll be able to sort it out for you, right? And those who want to have the demo class, what we do in these 12 days course, how it's gonna be done, demo is gonna be tomorrow. So the link is there. Our Mr. CJ has already shared. You can get it, right? So you can come in the WhatsApp group as well. I mean the course. How do I book the course? Okay, CJ, can you send the course link as well? Dr. Jaya, she wants to book. Yeah, or Dr. Jaya, if you come in the WhatsApp group, he can share it with you. But now he is sharing. Mr. CJ is sharing with Jaya, Dr. Jaya. Yeah. Okay. Anybody else? Any other question, guys? So I'm gonna share this as well. So don't worry, I'm gonna share this PDF. Once the course is done, I'm gonna share this PDF in the WhatsApp group as well. You can download and then have a look at that. But this Aspire study on spot, yeah. Book it. You have got share it with your friends as well because it's gonna be valid only for 24 hours and only maximum of 10 people can book it in this price. Again, that price is gonna go to that same like group of 5 and lovable, whatever it is, right? So it's gonna go on the same price. Okay, so